This is the case of a 30-year-old male patient who was admitted to the operation theater for hemorrhoid surgery under spinal anesthesia. The patient was fully conscious, oriented, and had no history of any major medical illness. Preoperative assessment was done carefully, and all vital signs were found within normal limits. After obtaining informed consent and ensuring that the patient had followed fasting guidelines, the procedure was prepared under strict aseptic precautions. The patient was shifted to the operating table and positioned in a sitting posture to facilitate the administration of spinal anesthesia. The anesthesia team ensured that the patient was comfortable, relaxed, and cooperative. His back was properly exposed, and the lumbar region was identified by palpating the spinal bony landmarks. The anesthetist located the space between the L3, L4 vertebrae, which is the most common and safe site for spinal puncture. The lumbar area was then cleaned thoroughly using povidone iodine solution, followed by spirit swabs in concentric circles from the center outward to remove all microorganisms and maintain sterility. After cleaning, sterile drapes were applied, leaving only the puncture site exposed. A small amount of local anesthetic was injected intradermally to numb the skin and underlying tissue. After waiting a few seconds for the local effect, a spinal needle was gently inserted in the midline at the chosen lumbar space. The needle was advanced slowly until a distinct pop was felt, indicating entry into the subarachnoid space. Clear cerebrospinal fluid, CSF, was observed flowing freely through the hub of the needle. 2 drops of CSF were allowed to flow out to confirm correct needle placement. After proper confirmation, bupivacaine heavy, also called BOP or NHP spinal injection, was slowly injected into the subarachnoid space under complete aseptic technique. Once the medication was administered, the needle was carefully withdrawn and a sterile cotton swab was applied to the puncture site. The patient was then positioned supine immediately to allow the anesthetic solution to spread evenly in the spinal canal. Within a few minutes, the patient developed adequate sensory and motor block of the lower body. The level of anesthesia was checked using a pinprick test, confirming that the block had reached the required level for perianal surgery. Throughout the entire procedure, the patient's vital parameters, including blood pressure, pulse, respiration, and oxygen saturation, were closely monitored. The spinal anesthesia provided complete pain relief, allowing the surgical team to proceed with hemorrhoidectomy without discomfort to the patient. The operation was carried out smoothly. The patient remained